This is my respiratory system. I'll be explaining how air travels through the system and how each part works within the system. So the best way for air to enter the body is through the nasal cavity or the nose. It is a space behind the nose that we see in the middle of the face. So the nasal cavity splits off into two nostrils that we can breathe air through these nostrils. These nostrils are lined with little hairs to prevent dust from entering into the body. So they collect all the dust when you breathe in air. So air from the nasal cavity enters the throat, but also air from the mouth or the oral cavity enters the throat. So it passes in through the lips and the teeth and the tongue and leads into the throat as well. So both of these passageways end up in the throat area. So the throat, or the pharynx, is behind the nose and mouth, and both of these tubes will connect into the throat, or the pharynx. So the pharynx is a large muscular tube that will bring down food and air, and they'll travel down into the esophagus or the larynx. So this is the esophagus right here, and this is the tube that brings down all the food and water into your stomach, but the larynx is right here, and this will bring down the air. So the larynx right here, it consists of the epiglottis, which covers over the esophagus tube and then allowing the air to go through the larynx instead of the esophagus tube, so then it won't go through the wrong pipe. Under the epiglottis is your supraglottis, which is the upper part of the larynx, so just the beginning of the part, and this consists of your vocal cords giving you sound. Right underneath that is the glottis, which is the opening to your vocal cords. Lastly, underneath that is your subglottis, which is the lower part of the larynx, going from all the way from beneath the vocal cords to the start of the trachea, which is right here. So the subglottis will regulate the temperature of the air that is coming into your trachea. Your trachea is also known as the windpipe. The trachea is from the passageway from the larynx all the way into the lungs. So the trachea is a place where the air will warm up or moisten. This is done by a layer of little hairs called cilia, and all the different air particles will warm up so it's not cold going into your lungs. The trachea is also known to protect the rest of the respiratory system from unknown particles that are going into your lungs. At the end of the trachea, it divides into the right bronchi and the left bronchi. So these tubes branch off into the right and left lungs. Going into the lungs, these bronchi branch off into even smaller tubes called bronchioles, and at the end of these smaller tubes, there are sacs, and these are called alveoli. So the alveoli performs your body's gas exchange. So the exchange of oxygen and carbon dioxide happens in these little sacs right here. So if you were to zoom in on the bronchioles, the different tubes are surrounded with smooth muscles like these right here, and this controls the air that opens and closes. So this controls the airflow into the lungs. Bronchial vessels supply blood to the lower trachea, the bronchi, and the lungs. So it's a very supporting structure to the lungs, but also to the pulmonary arteries. So the alveoli is a tiny sac at the end of the bronchiole right here. So it moves oxygen and carbon dioxide molecules in and out of the bloodstream of the rest of the lungs. The capillary network lines the bronchioles, and they transport gases, fluids, and nutrients to the rest of the body. The lungs have an elastic tissue structure to them, allowing them to expand and deflate. So when they fill up with air, they expand, allowing oxygen to come into the body, and then they deflate, getting rid of all the carbon dioxide out of the body that is in the air. The diaphragm is located underneath the lungs. It is a sheet of muscle that separates the organs from the chest cavity and those in the abdominal cavity. So the diaphragm moves down and upwards, so it will actually move as you breathe in and out. The diaphragm and the rib muscles pull the ribs upwards and outwards, this making the chest cavity bigger and giving lots of room for air to come into the body. When you exhale, the diaphragm moves upwards and the chest walls relax, causing the chest cavity to get smaller, and that pressure pushes all the air out of the respiratory system through the nose or the mouth. And then the rib cage is right here, and this protects the whole system as a whole. There's a rib cage on this side too, but this side is just to show all the bronchioles and the bronchi, but there's also a rib cage on this side. So one common infection is the sinus infection, and this happens in the sinuses. Sinuses are hollow and air-filled spaces in the skull, around the nose, nasal cavities. So mucous membranes line the sinuses and produce mucus that is normally drained by the nasal cavities. So in an allergy in the air, when you breathe that in, the mucus membranes become inflamed, and these inflammations will block the sinus openings, make it very hard to breathe, and very uncomfortable for most people. Another condition is called pneumothorax, which occurs when you have chest trauma. So this usually happens when there's a puncture or a tear into the lungs. Usually the rib cages will protect that, but if there is a puncture or a tear in the lungs, air will escape between these tears or punctures and build up in between the lungs and the chest wall. So all the air pressure outside of the lung will cause the lungs to collapse, and this is called pneumothorax.